Welcome on back here. You can get a free skin cancer screening today and tomorrow, and all done in an RV parked at the Tempe Public Library at Rural and Southern.
Very convenient. Anita Roman is out there live this morning with more on this. Good morning, Anita.
Good morning, and it's as easy as just showing up. So you saw we're right outside the library. Once you get inside, someone's going to take your information, maybe a little bit of a history to help the doctors out. And then they have 2 exam rooms just like this one. Amy is the driver of this awesome RV and works for the Skin Cancer Foundation. Doctor is volunteering his time to come do skin check. So you're just showing us on Amy what a skin check looks like, because they're oh so important. So when a patient comes in, what are you going to do?
Right, so to the extent that a patient is comfortable taking clothes off, we examine any skin surface that they're concerned about. You can get skin cancer anywhere you have skin, but the areas that get the most sun are the most valuable for examination.
And those would be?
Yeah, I mean face, chest, hands, areas, above the waist typically.
Legs, when we wear a lot of shorts and flip-flops out here, top of your feet. This is an interesting gadget. I've never seen one of these before.
This is called a dermatoscope. It's somewhere between a magnifying glass and a microscope, and we use it to examine the skin like this, so we can place it on a spot and look for different patterns that may reassure us that there's no atypical features or tell us that this is suspicious for skin cancer.
Okay, so how do you know if it's typical, atypical, suspicious?
The patterns that we look for take a long time to develop a sense to appreciate, so it's not something I can explain in a minute or two. But that actually is the importance of seeing someone with really good modern training, so it's why you should see a board-certified dermatologist for your skin exams.
So I have a lot of moles, and I get my skin check once a year, but I also look. When I get out of the shower and I'm putting lotion on, I'm always looking to see if anything is new. And you said you have patients who come to you and say this is new, and that is a big step in preventing or eliminating skin cancer.
Right, so catching skin cancers early is the most important thing to make sure that we limit the seriousness of the condition. So the cure rates for early skin cancers are very, very good. We got to find things early. Sometimes patients do identify spots, and they may be a skin cancer. So I always tell patients, if you're concerned about a spot that's changing in color, size, border, or just doesn't seem to heal or doesn't feel right to you, come on in and we'd be happy to give it a look.
How often do you recommend, especially living here in Arizona, that people do a self-check, and how often should they be going in for an exam? I go in once a year, for example, but then I probably am looking, every couple of weeks to see if there are changes.
That's a great question. It really depends on your risk. So, for example, if you're young and you don't have any family history of skin cancer, maybe going in once a year or every few years could be reasonable for you. But let's say you have a skin condition or have a history of skin cancer, or you have a job, or you're an athlete where you're outside for many hours at a time, or you have an extensive family history of skin cancer. All those are the types of things that might encourage, I might encourage patients with those risk factors to be examined more frequently. If you've had a melanoma, for example, which is a type of skin cancer, your risk of another skin cancer is very high. So in the years after your original diagnosis, we recommend skin exams every 3 months for the first few years.
Wow. So you mentioned catching it early is key. I guess take us through the differences, right? If you catch it early enough, how do you take it off? Are we cutting it off, and then how much deeper does that cancer grow a couple months later? And I know it's hard to tell because every case is so different, but that's the importance of being aware.
Exactly. So it's interesting. A lot of skin cancers, I like to tell patients, are sort of like a tree stump, where we can see that something's going on where above the skin or on the top of the skin, but they may have a root system underneath, and that may go down. They may not have many roots at all, or they may go out really broadly. So we always start with a small biopsy to look under the microscope to see what type of cancer are we dealing with and what stage.
Does that hurt, the biopsy?
It is an invasive procedure. We numb up the skin, so that part of the procedure is uncomfortable. It takes a needle, but after that, patients rarely feel much at all.
We don't want people to be scared. How long will you be here?
So the Skin Cancer Foundation is doing this screening event today and tomorrow. It's at the Tempe Public Library. It's from 10 a.m. to 4 p.m.
Yep.
And there will be a board-certified dermatologist offering skin exams to both today and tomorrow.
Awesome. Thank you. Thanks for volunteering. Thanks for being here. Great information, you guys. They have just literature. They'll give you some sunblock, which I've been sampling on my arms. They have all of the information that you could possibly need.
That's the best part about going to the dermatologist.
Yes, it is.
The free samples, Anita.
Samples.
I love a good
Samples.
sample.
Yeah, look, Juan, walk out for me. This is what I've been sampling, you guys. This giant jug of this.
Do you have a little container? Do you have a little container you can fill?
I have been pumping and slathering so that when I go swim laps this afternoon, I will be 100% prepared.
I like your sun safe.
Look
There
at
you
her.
go.
Here we go. Lather some on.
Show us how it's done.
And also, I have to say, the doctor commended me for my giant hats.
Yes.
Oh, you need the hat.
You gotta have the hat.
With the big wide brim. We love Anita's
Look at
hat.
that.
Yeah.
Look at that. Thank you,
She's
Anita.
very chic in her hats. We love it. We are going to take a quick break, and we will be